The obesity epidemic. You pick up newspapers and see swine flu on the cover of major magazines as a major health crisis. It's not. Obesity kills 300,000 Americans per year. It is singly the most important health issue in America. 68% of Americans are overweight, 38% obese. 88% of the African American female population is overweight. It is literally and figuratively killing Americans. Americans are spending over $343 billion a year on obesity-related health conditions. By the year 2030, between 30 and 35% of the American population is going to have diabetes mellitus. And for the first time ever, your children's generation has a less life expectancy than yours because of obesity. The aging effects of obesity: it ages the internal organs. Diabetes mellitus, heart disease, a number of cancers, arthritis, sleep apnea. The list goes on and on and on of the healthcare issues related to weight control. How did this happen? Americans are 20 pounds heavier now than they were 20 years ago. Our knowledge of medicine and what obesity does to the human body has increased. How in the world has this happened? Well, a couple of things. High sucrose food sources introduced a number of years ago. What do we pay for a bottle of Pepsi right now, one of those 2-liter bottles of Pepsi, on sale, 99 cents? What did you pay about 15 years ago for the same 2-liter bottle of Pepsi? 99 cents. Why do prices never go up? Government subsidies of high sucrose companies. If you look at the parallel growth of obesity in America, it completely corresponds with the growth of fast food restaurants in America. Less exercise? Absolutely. The cost of calories. People who have financial issues can buy a lot more calories for their families at a McDonald's than they can at a good food store. The dual working parent generation. Not the old days of Mrs. Cleaver at home preparing a good dinner and lunch and breakfast for Beaver. The internet generation. Our children are constantly on the internet and not outside playing. Lack of insurance company involvement. How many health insurers cover weight reduction programs? Not many. Lack of government involvement, effective government involvement. Yeah, they tell us we need to exercise more and eat less. It's not that simple. The last one, lack of physician involvement. Absolutely. Under our watchful eye, the obesity crisis gets worse and worse and worse. Physicians who are best positioned to help people lose weight are not doing very much. Why are physicians not involved with this? Several reasons. One, there's a lack of formal training in medical school and residencies on preventative health. It's mostly about the treatment of disease states. Well, lack of time with patients. With insurance companies cutting back significantly on reimbursements, we have less and less time with our patients. The time to talk about preventative care, minimal. Once again, insurance companies not providing reimbursement. You guys are running businesses out there. I run a business. If you're not paid to counsel people, you have to unfortunately go on and see your next patient. Well, most of us do take the time to tell our patients that need to lose weight. You're giving them prescriptions for diabetic pills and blood pressure pills, and you're telling them, you have a little bit of a weight problem, you probably need to eat less and exercise more. Well, if that's simple, 68% of Americans would not be overweight. Let's talk about the instinctual part of the brain. The cravings for food sources. We crave carbohydrates. We don't crave vegetables. Reward systems. We tend to all base reward systems around food. With age, metabolism decreases, especially for women. Social, family, and cultural issues. Whenever we get together with family or friends, what it is always based on? Always based around food. Human nature factors. Human beings like to do things that feel good. Stay away from things that don't feel good. And quite frankly, sitting down, having a nice meal, glass of wine, feels a heck of a lot better than getting to that gym at the hotel this morning at 7 o'clock and doing an hour on the elliptical, like Posner. Intellectual part of the brain. Now, that's a different part. That tells us that we need to lose weight. Why? First and foremost is health. We do realize, our patients realize, if they lose weight, they lower significantly the chances of heart disease, stroke, sudden death, and all the other health issues we mentioned. Vanity issues drives lots of people. We want to look younger. We want to be more confident and have higher self-esteem. Weight loss brings us that. That's females why they want to lose weight, and we have asked thousands of our patients, why is it important for you to lose weight? Clothes are mentioned as a separate category. And energy. When we lose weight, we regain lots of energy.